I have been a nurse now for 16 years. I currently hold a full-time position as an assistant professor for Southwest Baptist University, but I also am a nurse practitioner and have a part-time clinical practice in a rural family practice clinic that is owned by another nurse practitioner. A nurse practitioner is a specialty area. I would call it a clinical specialty area, and it's an advanced practice degree. And my training is as a family nurse practitioner, although most of my clinical background's been as a pediatric nurse. And so it took several years of graduate education and a lot more clinical time. I equate my graduate schooling almost to my original diploma degree. It was that intense and that much clinical. But I knew where I was headed and what I wanted, and so that's the route I took. Nurse practitioner degree has allowed me to move into primary care. So, and it's an advanced clinical degree, but I do a lot of primary care and patient education, which was my love. That's where I wanted to go. And it's allowed for a lot of autonomy in my nursing practice. And so when I go into the clinic in a day, I typically see somewhere between 20 and 30 patients. 30 is a very busy day. 20 is a good manageable day. I like to spend some time with them. I see everything from minor illnesses all the way to full physical women's health exams and sports physicals. Some days I may stitch. Some days I may call the ambulance because someone walks in with chest pain, but I try to avoid those days. But I do a little bit of everything. So all age ranges and all types, from chronic disease management to preventative education, which is really what I love to do. I just always knew I would go back to school as a nurse. And the more I've gone back to school, the more I've realized I don't know other things, and has perpetuated thus more schooling. But I always knew that I wanted to work on the education and the preventative end in primary care. I was an ICU nurse for many years. I loved that aspect, but preventing people from needing to be in that aspect was where I wanted to be. And so being a nurse practitioner was honestly the way to go for me. And so I started looking for good programs. I originally looked at pediatric nursing programs, knowing that that's where I wanted, but I wanted to expand what I knew. And so many of childhood illnesses just follow right into adulthood. And so much of what happened in childhood leads to adult chronic disease. And so I looked for a good family nurse practitioner program. I looked for something that had lots of heavy clinical in it, had good research and statistics so that I could interpret the research I would need. And I looked for something that had some dedicated courses to specialty areas like women's health and pediatrics in a family degree, because there was so much to learn. And then I went from there. Skill set. There's a lot, and sometimes I tell my students, you don't always enter into this education process with every single skill set you need, but you learn it along the way. You know, leaders are made, not born, so you can acquire new skill sets, but you've got to have curiosity. You've got to have a drive to want to know new things. You got to have tenacity, because sometimes it gets hard to finish what you're doing and balance life. But you know, what I found, in the further I go in education, it's not the most brilliant people that I might be sitting next to, or I might be, but it's people with tenacity who finish it. One that we always keep our patients in mind. It's never about me. Whatever I do is not, the end is not about me. It's about the patients. And so being willing to listen, being willing to take even feedback from patients or faculty and incorporate that into what I'm doing, and to meet my patients where they are. Those are critical. Independent nursing practice is not what it's cracked up to be. You know, I didn't enter this because I wanted to be a mini physician or something like that. This was just expanding my knowledge as a nurse. And we are fighting I fight battles every day for my patients. I have many patients without insurance, which means I may know that they need an MRI, but they're never going to go for an MRI. So learning the workaround and how to get them at least some aspect of treatment, fighting insurance coverage on that front. Practitioners are still doing that. Many insurance companies don't recognize us as providers, and therefore, if we don't get paid something, it makes it difficult to see the patient. Issues like controlled substance. I practice in a state where one of only 3 or 4 where nurse practitioners still do not have the right to prescribe controlled substances, which means codeine cough syrup. Well, gosh, for my patient with bronchitis, that's going to be something I can't give them, or treating a patient with ADHD. And so there are challenges and workarounds, but we just keep pushing forward. The practice is continually evolving, and it's baby steps. I've seen more nurses organize together to speak their cause, going and telling people what they do. I've seen more acceptance among patients. I've actually seen more patients seek out nurse practitioners because we spend a little bit of time with them and do some more education. But I've also seen some more teamwork among colleagues, which is excellent because we all have something to offer, and bringing that to the table for the patients. We're all peers. No one's better or worse than anyone else. We all just have a different knowledge set. And the ANA and places like the Robert Wood Johnson's Foundation are really pushing this initiative for nurses to practice to the full extent of what they know to help patients. I think healthcare reform is long needed. Like I said, I speak from a patient perspective. I have a rural practice. A large percentage of my practice has no insurance. And then the other large percentage is Medicaid or Medicare, which has posed some big challenges. And I think this is good. Healthcare reform so far has been about insurance reform, which has been drastically needed. Not that companies shouldn't make money, but the ultimate goal is patient health. And nurses can step right into that. We're geared for preventative care. We're geared for education. And so this is going to be a prime time for healthcare, hospitals, and insurance companies to start kind of rethinking how we do healthcare. It's not acute care reactive, which is where the majority of our money has gone, but it's preventing us from getting to that point. And nurse practitioners are primed to step in and assist with that aspect of healthcare. So I'm looking forward to that. I think this will be an exciting time. I definitely do. Between healthcare reform and the push for DNP education, which, honestly just terrifies some of my students someday. And I'm like, no, you need to run to whoever set that down as the standard and hug them, hug them, hug them. Because what has taken me 8 years in this process through a master's degree and then in a doctoral degree, they're going to be able to do in 3 or 4 years and be better equipped to take care of their patients and speak at the table. And so between healthcare reform and the 2015 push for DNP for certification, it's going to be good for nurse practitioners and ultimately our patients. I would say move forward with that. When I started each aspect of my career, especially this last part of education, I thought, oh my gosh, this is going to take so long. I don't want to do this. And my husband gave me some very sage advice. He said, in 5 years, you will be the same age as you will be in 5 years. And what do you want to have accomplished in that time? And so don't look at it as it will take so long. If this is your goal, just start chipping away at it. Look for programs where they'll openly communicate with you. I would also be very persistent in taking the GRE examination, even if a program doesn't require that, because it shows a program that you're serious about application process and you're not just applying to them. It also challenges you to expand your knowledge base and look for those programs that are going to push you in what you need to know. And I would also look for a program that's very heavy in clinical and theories and research, because in the end, even though you may be terrified going into that, you will be so much better off and you can do it, and it will be better for your patients. So looking for those challenging programs and just chipping away at it a little bit at a time.